This topic has turned out to be very timely given our provincial government's decision to hold a public conversation on health care.
And I think this is a real essence of the problem in Canada right now. We're trying to have a debate about private versus public health care, and we haven't really set our terms of reference. What is private health care?
What constitutes universal health care? By universal health care, I mean a system that allows access to health care based on need and not ability to pay. So I'm referring to a system of public funding that is accessible to all members of our community. So, for example, most doctors, even though they run their own private practices, are part of universal health care because patients are able to access them as long as they have a care card.
Fundamentally, what we have to ask ourselves is, what in fact are we comparing here? Is it a system where the government is funding most of it and there's some private involvement, a mixture of private involvement? Is it all private involvement?
So does Canada have a universal health care system? The answer to that is about 2/3 yes and 1/3 no. At present, about 70% of our health care is publicly funded, and 30% still depends on the ability to pay. Dental care, drugs, community-based physiotherapy are all services that are privately funded.
I want to understand what we're talking about, and the frustrating part for me, and I'm part of the debate sometimes more than I want to be, the frustration is that I hear people mixing models when they're making their arguments and discussions, and I think it makes it very, very confusing for people to actually make the right determination. And I really hope that in this upcoming dialogue that the government is going to have with people, we make it really clear what we're actually talking about.
In fact, Canada ranks 17 out of 30 OECD countries in relation to the proportion of our health care that is universal or publicly funded. And many European countries have far more universal systems than our own.
And when you look at the other countries, particularly in Western Europe, but some other countries like Japan, Singapore, there are many countries in the world who actually spend on a per capita basis far less than Canada does, and some of these countries have zero waiting lists at all.
The second question on the Vancouver Public Library list was, is universal health care important? Two recent commissions, the Romano Report and the Kirby Commission, concluded that ordinary Canadians place high value on a system of universal access. Many Canadians are aware of the high cost of health care in the U.S., where the number one cause for personal bankruptcy is inability to pay for costs of health care when faced with illness. And most of us aren't comfortable with a system that would allow that to happen here. The business community has also noted the economic advantage of Medicare, where in the U.S. benefits have been reported to be a key factor in 55% of all strikes. The Toronto Dominion CEO, in a speech to the Vancouver Board of Trade in 1999, described Medicare, and I quote, as an economic asset of our country that we dare not lose. It would appear that most people feel that universal health care is very important. But beyond the issue of what we feel or believe, what are the facts? Is a public system funded by the government the best way to meet health care needs? Would our system be better served with the introduction of parallel private insurance that allowed those who could pay to get their surgeries done sooner? Let's look at the evidence. And by evidence, I mean studies conducted by academics with no vested material interests in the topic and whose work has undergone rigorous peer review. We now have good evidence that publicly funded health care is cheaper and far more efficient compared to private insurance. Multiple studies across many jurisdictions and countries have demonstrated this to be the case. Private insurance companies have to develop insurance packages, market these policies against the competition, assess claims, and satisfy their yearly investors. All this jacks up the cost of health care. There's also good evidence that wait lists get longer when doctors and nurses work in public and privately funded systems at the same time, as these scarce resources are now spread between both sectors. There are many examples from Great Britain, Australia, and Canada that demonstrate this. Australia, with a healthcare system very similar to ours in the past, introduced a system where a large proportion of the population is now covered by private insurance. And the results have not been good. Wait lists remain long for publicly funded patients, and Australians are facing major problems of equitable access that do not exist in Canada. The government in Australia has also had to bail out the private insurance part of the system and introduce tax incentives to convince people to buy private insurance. We have good evidence that user fees don't save money and discourage those who need care most from seeking it, thereby potentially increasing the costs of downstream complications. Again, our two commissions, Romano and Kirby, both very prestigious and well recognized, reviewed the available evidence on these questions and all came to the same conclusions that I just outlined. My own professional association, the Canadian Medical Association, endorsed a report on the topic this year, which concluded that private insurance for medically necessary services does not improve access, does not lower cost or improve quality of care, can increase wait times for those who are not privately insured, and could worsen the shortage of healthcare professionals in the public system. So to answer the question, is a public system funded by the government the best way to meet healthcare needs? The answer is yes, it is.
I'm a big supporter. I'd like the debate to be about, let's make it more simple. Can we talk about a private health, a healthcare system that's largely government funded, but that we allow private providers to provide services within that environment? That's what I believe in. That's what most of my colleagues believe in, at least the ones that are engaged in this debate. And let's bring it down to, and I'd like to hear the arguments for why, for how it makes sense that we wouldn't allow competition into the healthcare system. There's no evidence that supports that this is a bad thing at all.
Can our healthcare be better provided through a single government-controlled model, a totally privatized model, or a mix? In other words, services would still be universal, accessible to all who need them through a government-run insurance system. But should we increase the role of the private for-profit sector in the delivery of care? Here, too, we already have some mix. Physician services, some pharmacy services are all publicly funded and yet privately delivered. Should we expand this? Would this make us more efficient? This is currently on the table, particularly in relation to establishing for-profit surgical clinics where groups of entrepreneurs would be encouraged to bid for government contracts to perform outsourced services outside of public hospitals. Interestingly enough, most physicians in this country are private businesses. They're professional corporations that collect revenues, some from private out-of-pocket sources, some mostly from the government. They run offices, small businesses. They try to minimize their expenses so that at the end of the day they make a profit. And it's kind of what makes the world go round. Again, the evidence tells us that corporate for-profit health care, even if it is publicly funded, will not improve outcomes and tends to undermine the public system. Such clinics must make their profit by what is called cherry picking. That is, in order to be able to generate a profit, they have to make sure that the cost of a procedure is less than what the government pays them to do the procedure. Such clinics tend to only accept the easier patients, leaving the more complicated ones to the public system, and when surgical complications do arise, these patients get transferred back to the public system very promptly. Staff working at these clinics, nurses, often keep their part-time status in the hospitals so that they can retain their pension and other benefits there while drawing a higher wage in the private clinic. Offloading complex patients and the cost of staff benefits onto the public system are two ways that for-profit clinics can generate a profit at the expense of the public system. Some walk-in clinics do a very similar thing in primary care. Many such clinics, the walk-in clinics, make their money from the easy one-time visits such as colds and coughs, where full-service family doctors are paid the same amount per visit to provide continuity of care and address multiple problems for complex patients with chronic disease. I can tell you that walk-in clinics have been a very big factor in increased workload and burnout for family doctors. The widespread introduction of private surgical clinics may well have the same effect of undermining public hospitals by placing an unequal burden on these already stressed institutions.